Hello and welcome to this edition of the Native News Update on Thursday, October 22nd. I'm your host for today's program, Kimberly Acosta. Many of the stories you hear here today can be found at our website, IndianCountryNews.com, or you can check out IndianCountryTV.com. And here's the news for the day from the Associated Press and other Native news sources. The self-help expert who ran a program at an Arizona resort where 3 people died this month says it has been a difficult period, but that he will continue his schedule of events despite the deaths. As details emerge of what happened in the Sedona incident, Native Americans are criticizing everything from the number of people who were in the tent-like structure to the fact that people paid to be there. A survivor of the Sedona tragedy is now suing motivational speaker James Arthur Ray, saying she nearly died from kidney and liver failure. Sydney Spencer, 59, said she paid $9,000 to attend the 5-day retreat, at which Ray promised that participants would be cleansed from sitting in a 120-degree makeshift sweat hut. Other participants inside had said that they were screaming, "We need water," vomiting, and fighting to stay alive. They claim Ray said vomiting helps purge the body of what it doesn't need and coerced them to remain inside the sweltering tent. Survivor Beverly Bunn told the Associated Press that even while people were collapsing, vomiting, and gasping for air, Ray, who was leading the ceremony, urged everyone to stay inside. While people were not physically forced to remain in the tent, Bunn said Ray would chide them if they wanted to leave, saying weakness could be overcome. Burnt said that she remembered hearing another person inside the tent trying to alert the group that one woman was having physical problems, saying, "I can't get her to move. I can't get her to wake up." And according to Bunn, Ray responded, "Leave her alone. She'll be dealt with in the next round." The U.S. Census Bureau is considering hiring locals to do the 2010 count in Alaska Native villages. Barbara Fleek, a partnership specialist with the U.S. Census Bureau in Alaska, says locals know the community best and could be very effective. The idea was discussed October 21st at a conference in Anchorage. The meeting brought together tribal liaisons from around the state who are working with the Bureau to make sure Alaska Native villages are properly counted in 2010. A bill introduced last week would permanently reauthorize all current American Indian health care programs. The bill, the Indian Health Care Improvement Reauthorization and Extension Act, was introduced by Senate Indian Affairs Chairman Byron Dorgan of North Dakota, and it now has 16 other co-sponsors. The measure, they say, will improve health care for 1.9 million American Indians and Alaska Natives. Some of the co-sponsors include Senate Majority Leader Harry Reid of Nevada, Senator Lisa Murkowski of Arkansas, and Senator Al Franken and Ann Klobuchar of Minnesota. Provisions of the bill include permanently reauthorize all current Indian health care programs, authorize programs to increase the recruitment and retention of health care professionals, such as updates to the scholarship programs, demonstration programs which promote new innovative models of health care to improve access to health care for Indians and Alaska Natives, authorize long-term care, including home health care, assisted living, and community-based care. The current law provides for none of these forms of long-term care. Establish mental and behavioral health care programs beyond alcohol and substance abuse, such as fetal alcohol spectrum disorders and child sexual abuse and domestic violence prevention programs. Establish demonstration projects that provide incentives to use innovative facility construction methods, such as modular component construction and mobile health stations, to save money and improve access to health care services, and to require that the IHS budget account for medical inflation rates and population growth in order to combat the traumatic underfunding of the Indian health system. A judge ruled that a Canadian man charged in federal court with the killing of fellow American Indian movement activist in 1975 is not entitled to documents from a state court on charges filed there. John Graham's lawyer argued that grand jury transcripts and an unredacted indictment should be turned over because they are part of an evidence in the case. But the judge disagreed, saying there are no grounds for such an order. Graham and Richard Marshall are charged in federal court with killing or aiding the murder of Anna Mae Aquash. That case is on hold, but Graham is also charged in state court in Rapid City, South Dakota, along with Thelma Rios. Prosecutors say Aquash was killed because she was a suspected government informant against the American Indian movement. California State University at Monterey Bay will celebrate National American Indian Heritage Awareness Month with a screening of the award-winning documentary Trail of Tears: Cherkasee Legacy on November 9th. The community is invited to the free screening, which will be held from 6 to 9 p.m. Pacific Standard Time in the University Center on 6th Avenue. The film documents the forced removal of a Cherokee Nation from southeastern United States to Oklahoma in 1838. More than 16,000 Cherokees were forced to Oklahoma while whites grabbed arable lands and prospected for recently discovered gold in Georgia. Stephen Heap, the film's executive producer and a citizen of the Cherokee Nation, will be on hand to discuss the film and to answer questions. Also in attendance will be Patty Jo King, American Indian historian and lecturer at the University of Oklahoma, who is also an advisor on the film. The U.S. Department of Justice has awarded the University of Montana a $500,000 grant to create culturally based research methods with tribes on the Fort Peck Reservation. The partnership will examine community and cultural characteristics that increase resiliency and identity among Native children. Researchers will also investigate how adverse childhood experiences may affect substance abuse and academic performance. University researchers at the National Native Children's Trauma Center will use a new research method in which local leaders initiate and direct research within their communities. researchers and tribal leaders will create an advisory board responsible for assembling the community research team to manage data collection, analysis, and dissemination of the findings. And that is the latest roundup of news from Indian Country on this edition of the Native News Update. I'd like to thank you for joining us and have a grand day.